Good afternoon again. Now, last week we have studied the scalp and we have finished with the scalp and started the face. We studied the anatomy of the face, the skin, the superficial fascia with the muscles of facial expression. Now, today we will start with the nerve supply of the face. Now, we have seen that the face is covered with the skin, so it needs sensory supply. All of you, you feel touch, pain, temperature, hot or cold. So this needs sensory supply to the face. In addition, it needs motor supply for the muscles of facial expression. They need a motor supply for them. In addition, we have sweaty glands in the skin. We have the hair in the skin of the face, and these are supplied also. It needs autonomic supply, which is sympathetic supply and parasympathetic supply. Sorry. Now we will start first with the sensory supply of the face. Generally, the sensory supply of the face, all the face, is supplied by the fifth cranial nerve, which is the trigeminal nerve. The trigeminal nerve, from its name, it's formed of three branches. Tri, it means three, and geminal, it means branch. That's why it's called trigeminal nerve. This is the fifth cranial nerve. The fifth cranial nerve, trigeminal, emerges from the brain, and then enters inside the cranial cavity. It divides immediately into three branches within the cranial cavity. Then the three branches of it emerge outside of the cranial cavity from foramina in the skull. These three branches of the trigeminal are first the ophthalmic, the maxillary, and mandibular. From their names, the ophthalmic is for the eyeball. The maxillary is for the region of the maxilla bone, and the mandibular is for the region of the mandible. Now, these three branches, the ophthalmic, the first one is purely sensory branch, is the main nerve supply for the orbital contents, that's the eyeball and the adnexia structures of the eyeball, but it gives branch which emerge on the face for the supply of the skin of the face. It gives rise to five branches which emerge from the orbit and supply skin of the face. These branches are the supraorbital. The first branch, this is the supraorbital branch. The supraorbital emerges from the supraorbital foramen in the orbit, just above the superior orbital margin, and pass upward to divide into two branches, medial and lateral branch, supplying the skin of the forehead till the middle of the scalp. This is the supraorbital branch. Next, we have the supratrochlear branch. From its name, supratrochlear, supra, it means above, superior, and trochlear, this emerges from the orbit above the trochlea of the superior oblique muscle of the eyeball. From the orbit and ascends again into medial aspect of the forehead, supplying the medial aspect of the skin of the forehead. These are the two supratrochlear branches. Next, it has a lateral palpebral branch. This is a small branch. From its name, lateral, it means on the lateral side. Palpebral, it's for the eyelid. It emerges here. It's not shown in this picture. In this slide, emerges here is a small branch supply the skin over the lateral portion of the lateral eyelid and the skin above it over the eyebrows. The fourth branch of the ophthalmic is infratrochlear branch. From its name, this resembles the supratrochlear. Both of them, when arise emerge above the trochlea of superior oblique. The infratrochlear, it's inferior to the trochlea, emerge here at the medial angle of the eye. This is the infratrochlear branch. On each side, the infratrochlear branch supplying skin over the medial aspect of the orbit and the skin of the part of the nose and this portion. Lastly, the fifth branch of the ophthalmic nerve is the external nasal one. This is a terminal branch of ophthalmics immersed between the cartilaginous and bony part of the nose toward the skin for the supplying of the skin. These are the two external nasal branches. These are five branches of the ophthalmic. They supply an area like that, a triangular area starting from the middle of the skull, passing toward the medial angle of the eye till the upper portion of the philtrum of the nose. This is another triangle from here like that. This is the area supplied by ophthalmic nerve through five branches: supraorbital, supratrochlear, infratrochlear, and external nasal, with the lateral palpebral which emerges. Here is a small branch. This is the ophthalmic branch from the ophthalmic nerve. Now the maxillary branch of the trigeminal nerve, this is the second, also is pure sensory branch. From its name, it supplies the area surrounding the maxilla. This maxillary nerve supplies lot of internal structures. We will see later on that supplies the whole upper teeth, the roof of the oral cavity, floor of the nasal cavity, the nasal septum, the nasopharynx. So all the structures related to the maxilla are supplied by this nerve. But in addition to these, it gives rise to three branches which emerge on the surface of the face, supplying the skin. These three branches are the infraorbital, which is this one, infraorbital branch, which emerges from the infraorbital foramen and divides into three branches. Divides into three branches: a short trunk. Short trunk divides into three branches: a palpebral branch, which ascends upward for the supply of the skin of the lower eyelid, and then the nasal branch, which passes to a supply for the lateral aspect of the nose, and then a labial branch which descends for the upper lip, supplying the skin of the upper lip. So three branches from infraorbital, a nasal for the nose, skin of the nose, a palpebral for the lower eyelid, and the labial for the upper lip. Next, it gives rise to the zygomaticofacial, which is this one. The zygomaticofacial branch emerges from the zygomaticofacial foramen and supply the skin over the zygoma. On both sides, the zygomaticofacial branch. Next, we have another branch, which is the zygomaticotemporal branch. The zygomaticotemporal emerges from the posterior aspect from the zygomaticotemporal foramen and supplies the skin over the lower part of the lateral part of the lower eyelid and skin over part of the temple. So from the maxillary, we have three branches, but one of them divides into three, so the total will be five branches. The infraorbital dividing into nasal, palpebral, and labial. Then you have zygomaticofacial and zygomaticotemporal branches. So the maxillary nerve supplies this portion, another triangular part like that over the skin of the face. Now, finally, the third branch of trigeminal nerve, which is the mandibular nerve. The mandibular is a mixed nerve, contains sensory and motor fibers. From its name, the mandibular supplies all the structures related to the mandible. So supplies the lower teeth, the mandible itself supplies the floor of the oral cavity. In addition, it supplies the motor part of it, all muscles of mastication. But the sensory portion of it, the sensory part, this gives rise to three branches which emerge on the surface of the face. And these are the buccal branch. This is the buccal branch of the mandibular nerve, passes over the buccinator, supplies the skin over the buccinator muscle, that's over the cheek, the buccal branch of the mandibular nerve. Next, we have the Mental branch, this is the continuation of the inferior alveolar, which enters inside the alveolar canal of the mandible and then divides into mental and incisor. The mental emerges through the mental foramina of mandible into the surface of the skin for the supply of the skin of the chin on each side, the mental branch. Lastly, the third branch is the auriculotemporal. From its name, auriculotemporal, supplies the auricle and the side of the scalp. The side of the skull, the auriculotemporal nerve, emerges from the mandibular and enters into the parotid gland, then emerges from the parotid anterior to the auricle, ascend upward into the scalp, into the lateral side of the skull, dividing into an anterior and posterior branch for the supply of and supplies the anterior portion of from the mandibular. Again, we have three branches: buccal, mental, and auriculotemporal nerves. Now, so I have seen that the trigeminal nerve supplies sensory to all the face. To all the face is by the branch of the trigeminal nerve. The only portion remains is at the angle of the mandible. The skin over the angle of the mandible, small portion. This is supplied by a branch from cervical plexus, which is the great auricular nerve. The skin over the angle of the mandible. The rest all are supplied by the trigeminal nerve from the middle anterior aspect of the scalp, the skin of the forehead, and all the face, together with the anterior aspect of the auricle, except the angle of the mandible is supplied by a branch from greater auricular nerve. Now we go to the sympathetic supply. Now the sympathetic supply, all the sympathetic supply for all the face and also all the structures within the head and neck are supplied by superior cervical sympathetic ganglia. The superior cervical sympathetic ganglia is a sympathetic ganglia situated in the upper part of the neck. Postganglionic sympathetic fibers emerge from it and they form plexuses around the arteries reaching to the face. They accompany the sensory nerves. These postganglionic sympathetic fibers, they supply the sweaty glands of the skin. They supply the erector pili muscles of the hair, of the hair. Stimulation of these sympathetic nerves lead to erection of the hair and lead to vasoconstriction and the vessels around the vessels, vasoconstriction of vessels leading to pallor of the face. The face become whitish in color because there will be decreased blood supply because of vasoconstriction and lead to excessive sweating. Excessive sweating also. This is what occurs when you are in fear. When you become fear, for example, if somebody now came to your house and they had a gun machine and all of a sudden he fights you, then you will get fear, so you will get palpitation. In addition, you will get paler face, you will get erection of the hair, and you will get a lot of sweating. This is a sympathetic supply. This is the nerve or sympathetic nerves, as you know, we have studied in the last year, is the system of alertness. So all the sympathetic supply accompanies the sensory nerves is derived from superior cervical sympathetic ganglia. So this is for the sensory and sympathetic supply of the face. Now I'll pass to the motor supply. You have seen that the face contains a lot of muscles, which we call them muscles of facial expression. Now the whole motor supply to all muscles of facial expression, if you have seen those surrounding the orbit, which we call them the orbicularis oculi, those surrounding the nose, the nasal muscles, and those surrounding the oral orifice, the orbicularis oris muscle with the buccinator, and another muscle in the neck again. This is the platysma. The superficial fascia of the neck is considered also a muscle of facial expression. Now, if you remember, we have said last week that the face muscles of facial expression, all of them are derived from the second pharyngeal arch, and the nerve of the second pharyngeal arch is the facial nerve. So all these muscles are supplied by the facial nerve. So the facial nerve is the sole motor supply for all muscles of the facial expression, including the auricular muscles, those muscles of the auricle, which are rudimentary in the human being, and the scalp muscles, which you have seen, the occipital belly and frontal belly of occipitofrontalis, and the temporal belly of it, in addition to the platysma, which is a muscle of the neck. Again, the facial nerve is the seventh cranial nerve. The facial nerve is not only motor, contains other components, contains sensory components for the middle ear, contains also for the parasympathetic, preganglionic parasympathetic fibers for parasympathetic ganglia, the submandibular and the pterygopalatine ganglia, and contains also test fibers for the anterior two-thirds of the tongue. We are not concerned with these now, we study these later on, but the facial nerve emerges from the brainstem, leaves the cranial cavity by entering through the internal acoustic meatus of the scalp, and then passes in the posterior wall of the middle ear in the facial canal, then emerges into the base of the skull through the stylomastoid foramen. Emerging from stylomastoid foramen, enters within the parotid gland, and then within the parotid gland, it divides into 5 terminal branches, which emerge from the deep surface of the parotid and spread to supply facial muscles. So the facial nerve, emerging from the stylomastoid foramen, enters inside the parotid gland, and then divides within the parotid into terminal branches which supply the muscles of facial expression. You see here in this slide, we have removed portion of parotid gland to see the facial nerve inside it. Here is the stylomastoid foramen emerging from it, and then entering into the parotid gland. You have removed in this slide portion of parotid to see the terminal branch of the facial nerve. Here you see in this, the parotid is intact, and now you have removed a portion of it to see the 5 branches of facial nerve. Now, before I go to the 5 branches of the facial nerve, the facial nerve, as it emerges from the stylomastoid foramen, it gives rise to a branch which is called posterior auricular branch. This is the posterior auricular branch here. It passes backward behind the auricle, supplies the auricular muscles and the occipital belly of occipitofrontalis. This is the occipital belly of occipitofrontalis and supplies these auricular muscles. Posterior auricular muscle. Then it enters within the parotid gland, divides into 5 terminal branches. The first one is called temporal. The temporal ascend upward, emerge from the upper pole of the parotid gland and divides into 2 branches, a frontal and a temporal branch. These supply the temporal belly of the epicranial aponeurosis and supplies the superior auricular muscles. The frontal branch supplies frontal belly of occipitofrontalis and partly the orbicularis oculi. This is the temporal branch of facial nerve. Next, we have the zygomatic branch. This again might be 1 or 2 branches. They pass toward the lateral angle of the eye, supplies the orbicularis oculi muscle and part of the zygomaticus major and minor muscles with the nasalis. This is the zygomatic branch. Then you have the buccal branch. The buccal branch of the facial nerve, this passes forward toward the angle of the mouth supplies the buccinator muscle, and the buccal branch supplies the buccinator muscle and part of the muscles of the upper lip. This is the third one, temporal, zygomatic, and the buccal branch. Then the fourth one, this is the marginal mandibular. From its name, it passes along the lower border of the mandible to supply the mentalis muscle and other muscles of the lower lip. And finally, a branch descend downward into the neck. This is the cervical branch. This supplies the platysma. As I said, this is again a superficial muscle in the superficial fascia of the neck, as is considered as a muscle of facial expression because it arises from the second pharyngeal arch. Now the division of the facial nerve, the 5 branches of it, if you put your hand onto the side of your face with the thumb upward, and the other fingers, the other 4 fingers, the thumb upward, and then the index finger toward the angle of the eye, and the middle finger over the zygoma, and then the ring finger over the mandible, and the little finger down into the neck. These represent the 5 branches of the facial nerve. The thumb will be the temporal, ascending vertically, and then the index pointing toward the angle of the eye is the zygomatic branch, and then the middle toward over the buccinator toward the angle of the mouth. This is the buccal branch, and then the marginal mandibular. This is the ring finger along the mandible, and little finger is the cervical descending into the neck. So these are the 5 branches. They supply all muscles of facial expression. In addition to these muscles of facial expression, you have seen supplies occipital and frontal belly of occipitofrontalis with the auricular muscles through the posterior auricular branch. In addition, the cervical branch supplies also the the posterior belly of digastric muscle, because all these muscles again are derived from the second pharyngeal arch. Now, one of the common affections of the sensory supply of the nerve is what's called trigeminal neuralgia. Trigeminal is from the trigeminal nerve, and neuralgia is disease of the nerve. And trigeminal neuralgia usually affects the maxillary branch of it, usually the maxillary, and in this case leads to severe pain in the area of the supply of the maxillary nerve, that is through the infraorbital, zygomaticofacial, and zygomaticotemporal. The patient will have shouts of severe pain which cannot be relieved by simple analgesics. You need a lot of analgesia, and this is usually occur due to demyelination of the nerve. The myelin sheath will be removed, occurs on the maxillary nerve because this lead passes through the cavernous sinus, and with the pressure of internal carotid which passes with it in the cavernous sinus, it might lead to demyelination of the nerve because of this demyelination of the nerve. We call it trigeminal neuralgia, or it's called in French tic douloureux. Now, the facial nerve again is subjected to injury. In one of the cases, in otitis media and infection of the middle ear, there might be pressure on the facial nerve while it passes in the facial bony canal behind or on the posterior wall of the middle ear. Pressure over the nerve might lead to weakness of the muscles of the face, and this we call it facial palsy. And if it is completely injured, it leads to paralysis, facial nerve paralysis of all the muscles of the face on one side. This sometimes occurs in operations on parotid gland because it's within the parotid gland. and the surgeon working on the parotid gland should be very careful not to injure the facial nerve or any of its branch, because all are within the parotid gland. Might become injured of buccal branch or temporal branch or zygomatic or the cervical or marginal mandibular, or might injure the main stem of the nerve within the parotid gland and lead to facial paralysis. بالعربي يسموه شرجي اللي يصير عنده facial palsy. And facial palsy, the patient, he cannot occlude the palpebral fissure. If you ask him to occlude the palpebral fissure, close his eyes, he cannot do it. The palpebral fissure remains open till the time, and during sleep also it remains open, and this might lead to dryness of the conjunctiva and lead to conjunctival ulceration or corneal ulceration, which is leading to corneal ulceration because of dryness of conjunctiva. And the patient also with facial palsy, one side of the oral orifice again will be paralyzed. So if you ask the patient to whisper, يصوفر, he cannot do it because the air will pass from, cannot close completely the oral orifice. And the angle of the mouth will be pulled to the unaffected side, because there will be loss of balance between the two sides in the tones of the muscles. Facial palsy, this would occur in the injury of the facial nerve. So this is for the nerve supply of the face. Nerve block in the face, which you will use it in your clinic sometimes, infraorbital block, and repairing maxillary incisor teeth, you should do, because this supplies the infraorbital, supplies also all the upper teeth. The site of injection of anesthesia, you should introduce the needle into the infraorbital foramen, which lies usually 1 centimeter below the lower mid-orbital margin. Inferior alveolar block, this is for the lower teeth, and the site is mandibular foramen. This is very difficult to perform, because if the needle goes more far, you might enter into the parotid gland again, and you do the anesthesia to the facial nerve branch, lead to a transient unilateral facial palsy, or you might injure also the parotid gland itself. Mental block and incisive is in the mental foramen for the incisor and lower canine teeth. Buccal nerve block, the site is into the mucosa, covering retromolar fossa located posterior to third mandibular. This is very easy to do it just behind the last molar teeth. Trigeminal nerve, I have just explained it. Dermatomes of the face, in this picture you see, this is the supply of the branch of the trigeminal nerve. The ophthalmic supplies this triangular region from the middle of the scalp down to the forehead and portion of the nose and the eyelids. Then the maxillary through 3 branches, through the infraorbital, through the zygomaticofacial and temporal supplies this triangular area. The rest is supplied by the mandibular branch. This area around the angle of the mandible is supplied by the, as I said, by the great auricular nerve, which is branched from the cervical plexus, and the rest of the scalp is supplied also by branch from the posterior portion by great occipital and third occipital. Now you will pass to the blood supply of the face. Now the blood supply of the face is through two origins, 2 sources, from the external carotid and from the internal carotid. Branch from the external carotid and branch from the internal carotid. The internal carotid and external carotid are 2 terminal branches of common carotid artery, which ascends into the neck for the supply of all the structures in the head and neck. It divides into two branches, external carotid and internal carotid, at the level of superior border of thyroid cartilage, where you can feel the pulsations of it in the carotid triangle of the neck. The internal carotid is mainly the nerve, the blood supply for the contents of the cranial cavity. That is the brain and the covering meninges, while the external carotid supplies most of the outside cranial cavity. Structures in the outside cranial cavity all are supplied by the branch of the external carotid. The internal carotid, as I said, is mainly the branch of for the supply of the cranial cavity, enters inside the cranial cavity, but it gives rise to the ophthalmic artery within the cranial cavity, and the ophthalmic artery is the main supply for the orbital contents, but it gives rise to branch which appears on the face for the supplying of the muscles and skin of the face. These branches of ophthalmic are the same, just like the artery. The artery, we have the supraorbital artery, which arises from the supraorbital accompanying supraorbital nerve, supplying the same area. We have supratrochlear, which accompanies the supratrochlear nerve. Supratrochlear on each side and supraorbital. Then we have the lateral palpebral branch, which emerges from the lateral part over the lateral skin of the lateral part of the upper eyelid. Then we have the infratrochlear artery. The infratrochlear artery emerging with infratrochlear nerve in below the trochlea toward the medial angle of the eye, and then we have the external nasal artery, which accompanies here, is not shown here, but emerges from here, supplying the same area, just like supplied by the ophthalmic nerve. Now, so you have 5 branches from ophthalmic artery: supraorbital, supratrochlear, infratrochlear, lateral palpebral, and external nasal. Now, the other branch which supplies the face, other artery which supplies the face, is the facial artery. Now, the facial artery in this picture is not completely shown. The facial artery is a branch of the external carotid, arising in the carotid triangle in the neck, and then passes in the submandibular triangle, ascends into the face just anterior to the masseter. If you clench your teeth, occlude your teeth, then the masseter stands out. Just put your finger anterior to the masseter. You can roll the facial artery anterior to the masseter over the base of the mandible, and you can feel its pulsations. From here, from the angle of the mandible, from the base of the mandible, it descends toward the face. Here is shown the facial artery, and it gives rise to 3 branches. A branch to the inferior lip is infralabial, another branch is given to the upper lip, is supralabial, and then extends toward the medial angle of the eye, where it's called angular artery, and it gives rise to a lateral nasal branch. This is for the facial artery. The facial artery has a tortuous course, is not straight, it's tortuous. This is because it passes over the mandible, and the mandible is mobile, so it should be tortuous, so that allows for the movement not to become stretched by the movements of the mandible. This is for the facial artery. Now, the other artery, which branch from the external carotid. Carotid is the 2 terminal branches of the external carotid. The external carotid artery ascends from the carotid triangle to behind the angle of the mandible, and then it enters inside the parotid gland also, together with the facial nerve, which we have seen it inside the parotid. And inside the parotid, the external carotid divides into two terminal branches. It divides into superficial temporal and maxillary artery. Superficial temporal and maxillary artery. The superficial temporal artery is the small of the two terminal branch emerges from the parotid gland anterior to the auricle, accompanying the auriculotemporal branch of the mandibular nerve, which we have seen supplying the skin of the temple, the auriculotemporal nerve. The superficial temporal artery, again, you can feel the pulsations of superficial temporal artery just anterior to the auricle over the zygoma or the zygomatic arch. This again passes to supply, divides into two branches, just like the nerve, into a frontal and the temporal branch, supplying the skin of the temple and the front skin of the front and anterior portion of the scalp. It gives rise to another branch in the face. It gives rise to the transverse facial artery, which passes transversely and joins with the facial artery, makes anastomosis with the facial, gives branch to that, also gives glandular branch for the parotid gland. This is for the superficial temporal of external carotid. Next, we have the maxillary. The maxillary artery, it leaves the parotid gland, enters into infratemporal fossa, and then from there enters into the pterygopalatine fossa and gives branch for the supply, just like the maxillary nerve, supplying the nasal cavity, supplying the roof of the oral cavity and the upper teeth, and then gives rise to three arteries which emerge on the surface, just like the branch of the maxillary nerve, and these are the infraorbital artery, which emerges from the infraorbital foramen, dividing into three branches, into a palpebral, into a nasal, and a labial branch, just like the nerve. Then we have on this side the zygomaticofacial artery, which emerges from zygomaticofacial foramen, accompanies the zygomaticofacial nerve, and from the posterior aspect we have zygomaticotemporal supplying the skin of over the temple. So the same, just like the maxillary nerve, three branches from the maxillary artery appearing on the face, infraorbital dividing into labial, palpebral, and nasal branch, zygomaticofacial and zygomaticotemporal branch. From this, we have see that there is a lot of blood supply to the face. All these arteries anastomose with each other. These branches of infraorbital anastomose again with the superior labial, inferior labial, and lateral nasal of the facial artery. Posterior auricular artery. This is not for the face. It just accompanies the posterior auricular branch of facial. This is for supply of the lateral aspect of the auricle and then to the occipital part of the scalp. Ophthalmic artery, as I said, it gives rise to five branches. Superficial temporal again gives rise with maxillary from three branches. Posterior auricular and internal carotid gives rise to ophthalmic. Now the venous drainage of the face, the veins accompanies the arteries. The veins accompany the arteries and they drain into corresponding vein. Those branches of the ophthalmic, they accompany, enters into the orbital cavity and they form the superior ophthalmic vein entering inside the orbit. The superficial temporal vein accompanies superficial temporal artery with the transverse facial. These enters into the parotid gland, and within the superficial temporal unites with the maxillary and they form what is called the retromandibular vein within the parotid gland. The retromandibular vein is not shown here, is inside here. It divides into two branches, into an anterior division which emerges from the below the parotid gland and join with the facial vein here. With the facial vein form the common facial vein which passes to enter into the internal jugular vein. The posterior division of retromandibular vein within the parotid. Posterior division emerges from posterior aspect and join with this posterior auricular vein. The two form the external jugular vein, which descends on the lateral aspect of the neck over the sternocleidomastoid muscle. So the only difference is that the superficial temporal with the maxillary and pterygoid plexus within the parotid form retromandibular vein, which is a short trunk, divides into anterior and posterior divisions. Emerging from the parotid, anterior joins with this facial vein, and the posterior division joins with the posterior auricular, forming the external jugular vein. Now the facial vein here at the angle of the eye, the facial vein joins with those tributaries of the ophthalmic. Angular vein joins with that superior tributaries of superior ophthalmic vein, and this forms a communication between the veins in this face and the veins inside the orbital cavity, which enters into the cavernous sinus. If you press on your face on this side, here on this side, and then the venous drainage will pass toward the orbital cavity. Sometimes if there you have boils in the skin, or what's بتسموها حب الشباب, if become infected, if you press over them, then bacteria might pass inside these veins, and through the connection of the facial vein with the ophthalmic veins, then infection might be transformed into the orbital cavity or into the cavernous sinus, or to the leading to thrombophlebitis, or might lead also to meningitis, spreading of meningitis. So we ask any patient not if you have any infection from the angle of the mouth to the ear like that. If it is on this area, you should never press over it, because this might lead to passage of these through the connection of the facial or angular vein with the superior ophthalmic vein, might transmit infection inside the cranial cavity. We call it the danger triangle of the face. This is the triangle from the two angles of the mouth toward the auricle. Anything above this area, you should not press over it. It might lead to passage of infection through this connection of pterygoid plexus and inferior ophthalmic and deep facial veins, lead to cavernous sinus through the superior ophthalmic vein, might lead to thrombophlebitis and meningitis also. Now, lymph drainage of the face. Again, the lymphatics accompany the veins. Superficial with the veins, and the deep they accompany the arteries. Now, in general, all the lymph drainage from the face is to the superior cervical lymph nodes. The superior cervical lymph nodes are a group of lymph nodes situated along the internal jugular vein in the carotid triangle. These are the group of superior cervical superior cervical lymph nodes. All these along the internal jugular vein in the neck, just below the mandible. We call them superior cervical lymph nodes. All the lymph drains into these nodes. Now there are a circle or ring of nodes at the junction of the face or the head with the neck. So at this ring, groups of lymph nodes, they drain the face and the skull. We have first just below the mandible, we have mental lymph nodes, or submental lymph nodes in the submental triangle. Then in just below the base of the mandible, you have submandibular lymph nodes. Then over the surface of the parotid, we have superficial parotid lymph nodes, and passing back behind the auricle, we have retroauricular lymph nodes. And we have occipital lymph nodes along the superior nuchal line, accompanying the occipital. So these, they form a ring of lymph nodes. All the face drains into submental, into the submandibular from the lateral side, into the parotid, On the lateral side again, retroauricular and occipital. Now all these, they drain. The submental drain to the submandibular, the parotid drain to the submandibular, the retroauricular drain to the superior cervical lymph nodes, the submandibular drain also drain into superior cervical lymph nodes. The importance of these, an infection in the face might be transmitted to these lymph nodes, and from there to the superior cervical lymph nodes. Remember that all the lymph drainage of the face is drained to the superior cervical sympathetic lymph nodes through a ring of nodes at the junction of the head with the neck. The submental, submandibular, preauricular, or are called parotid, retroauricular or posterior auricular, and occipital. All these drain into the superior cervical lymph nodes in the carotid triangle along the internal jugular vein. One of these nodes, upper cervical, is called jugulodigastric because it lies along the intermediate tendon of the along the posterior belly of the gastric muscle over the internal jugular vein is called jugulodigastric node. If these become infected, then become enlarged, and you can feel them into the upper part of the neck in the carotid and submandibular triangle. So this is for the lymphatic drainage. Lymph from lateral part of face and iris drain into the parotid. Lymph from deep parotid drain into the upper deep cervical. From upper lip and lateral parts of lower lip drain into submandibular lymph nodes. From the chin and central part of the lower lip drain into submental lymph nodes. From all these drain into the superior cervical lymph nodes. One of the diseases of the lower lip usually is squamous cell carcinoma of the lip. This occurs in the old age usually, and it involves the lower lip, and this might spread to the submental, and from submental to the submandibular lymph nodes, and from there to the upper deep cervical lymph nodes.